that, I think, is the biggest part of Breast Fest this year. But I would encourage you to come out every year because we are always showing really interesting films, really interesting artwork, and we always have incredible panels, including the one tonight. And after films, to just take that dialogue further. I mean, one of the key components of Breast Fest is to make sure that we talk about subject matter that isn't necessarily being talked about in the regular breast cancer world, whether that's, you know, just because there's not enough time, or it's just kind of maybe a little bit of fear around it. Whatever it is, we try to bring those out at Breast Fest. So sometimes our conversations get heated, and we love that.
We had a great panel discussing mammography, which has been in the headlines so much. We showed an amazing documentary from the UK, the documentary was really questioning some of the benefits and talking about the limitations and potential harms of mammography screening, but we had an excellent panel there to address some of those points raised in the film and really help our audience understand. We had a great documentary called Beyond the Silence, which was looking at immigrant women in Alberta and what they've gone through, some of them with their diagnosis. And as Michie said, the SCAR project itself, what I love about it is that it is showing another side to the representation of breast cancer in our society. You know, Rethink, as I said, we're really known for our bold, upbeat approach, which is great. We have an event called Booby Ball, which is a super fun fundraising night, and we love that. But I've been working in this field for 15 years, and you don't see images like this very often, even in our own education work. You know, it's always the great pictures of survivors hugging at runs and, you know, pink ribbons and we're champions, and that's all important and great. But what we love about this whole project is it shows the complexities of the journey for young women and for all women dealing with breast cancer. As David J. says, breast cancer is more than a pink ribbon. It's a lot of stuff in between, and we think these images do a great job representing some of those complexities that young women with breast cancer deal with. So we're really happy that everyone here had a chance to see these pictures tonight.
So without further ado, I think we'll call up Shauna Ginsberg, who is, what is it? I can never remember the title.
Manager of Support and Education Programs.
Manager of Support and Education Programs. I just think of her as the queen of our programs. So that's my title for her. So Shauna Ginsberg, thanks.
Hey everybody, good afternoon, or good evening. Thank you for coming and thank you for being here today. Tonight we are really pleased to have our first speaker series in the gallery with the STAR project. And we really wanted to bring in some themes and discussions around what some of these images evoke. And so the one that came to mind, one of the ones that came to mind was around Reconstruction, but not the A to Z of Reconstruction or about Reconstruction, because you can Google that and learn a lot about it, but more a discussion as to the realities of Reconstruction and what that really means. It's not an easy decision that a lot of women have to make, whether they're doing it prophylactically, if that's a word, or they're doing it as a result of having breast cancer, or whether they choose not to do reconstruction. And there's a complicated decision there as well. So the reality is that it's a complicated decision, and the outcome sometimes is not what people expect. Hopefully it is. But sometimes it's not, and so sometimes people have expectations of what the breast are going to look like, and the end result is not what they had hoped. So really tonight is a discussion about the ins and outs of that. We have some amazing panelists here, and I want to just thank them all for coming. Tonight our panel is being moderated by Dr. Toni Zhong from the University Health Network, and I will read her bio in just a second, which is quite long and accomplished. We have Kathy here with us this evening, we have Sandra here, and we have Karen, and we will learn a little bit about their story.
Adrian.
So sorry. research grants and numerous Canadian and American Plastic Surgery Foundation funds. She is also the co-director of research for the Women for Women, a non-profit humanitarian organization for the International Plastic and Reconstructive Aesthetic Surgery Society. Dr. Zhong obtained her Master's of Health and Sciences in Clinical Epidemiology from the Harvard School of Public Health following her clinical fellowship. She was recruited to join the Division of Plastic and Reconstructive Surgery at the University of Toronto in November 2008. She is an assistant professor, fellowship director for the Breast Reconstructive Fellowship Program, and the fellowship director for the Division of Plastic and Reconstructive Surgery at the University of Toronto. In addition to her clinical interest in all forms of complex reconstruction, post-oncologic ablation, thank you. She is the clinical and research lead of the Breast Reconstructive Program at University Health Network, a leading center for advanced techniques in breast reconstruction in North America. To complement her clinical expertise in the field of breast reconstructive surgery, her research aims to improve the access of women to optimize techniques of post-mastectomy reconstruction through clinical trials and health services research. Thank you for being here. Dr. Zhong, you're obviously a very busy. And a special thank you to Kathy, who actually came all the way from Thunder Bay to be with us today. I would also like to thank the University Health Network, who helped us put on this panel today. Without you, we couldn't have done this, so thank you so much. I'd also like to thank Willow Breast Cancer Support Canada for co-presenting this with us as well. You're an important partner in all of the work that we do. For those of you who don't know about Willow, they're an amazing organization that helps provide support, education, and resources for women going through breast cancer, their families, and for families dealing with hereditary breast cancer and ovarian cancer issues as well. So if you'd like to learn more about them, they have some resources on the table over there, as well as a sign-up sheet if you'd like to get on their contact list. So I think I've spoken enough. What I will say is sometimes the images in the room can be very, very powerful and overwhelming. If you need an ear or you just want to talk to someone after the panel is done, please come and find me. We also have a great support team through Willow. We have Danielle, Linda, and Natalie here as well, and they'd be happy to chat with you too if you just need a bit of extra support. So without further ado, thank you for being here, and here's our panel, Realities of Reconstruction.
So, I'd like to first thank everybody for coming out this afternoon, and thank the panelists for being here. So, aside from everything that Shauna has said about me, probably the one thing that didn't come out in that long bio sketch was that I'm humbled to be sitting here with everyone. I have the great privilege of seeing these wonderful, remarkable women come to my clinic every day. So, allow me first to introduce everyone. I'm going to start with Karen. So Karen's sitting to my far left. What I will do is give you a very brief clinical background on everybody, and then we will begin the discussions. So we chose the three panelists because they came from very diverse backgrounds, and they all have a very unique perspective on the things that they've been through. So Karen was diagnosed with breast cancer in 2008 when she was only 37 years old. At that time, Karen had 3 young children. They were aged 2, 3, and 7. The diagnosis of breast cancer came as a major shock to Karen because there was no family history, so there were no warning signs. Shortly after being diagnosed, Karen underwent a complete mastectomy. After that, she had chemotherapy, followed by radiation, followed by a year-long of Herceptin treatment, which is intravenous endocrine treatment. Now, 5 years later, Karen is still on tamoxifen treatment, and I believe you're currently contemplating perhaps getting your ovaries removed to decrease your chance of getting recurrence. So that's Karen's story. Next, we have Andrea. So Andrea is a patient of mine. I met Andrea when, I think it was last year, when Andrea birth to her first child, who was a 7-month-old baby girl. Andrea at that time had already been undergoing regular surveillance with mammography, MRIs, and physical examination. She had been undergoing that for 7 years. Andrea was only 35 years old when she was first diagnosed as being a gene carrier for breast cancer. And at the time when Andrea was seeing me, she was also seeing our gynecologist in talks about getting her ovaries removed. So shortly after I met Andrea, we decided to perform the prophylactic mastectomy with reconstruction. And in the same operation, she also had both ovaries and tubes removed. So it was a very, very brave decision that a choice that she made. And I'm proud to say that she just completed her reconstruction in October of last year, and with successful surgeries, and now she's here. And lastly, we have Kathy. And as Shauna said, Kathy has come all the way from Thunder Bay. Kathy also has a very different story. Kathy was first diagnosed with in situ breast cancer, which is not quite breast cancer yet, in 2009, when she was 45 years old. Unfortunately, she had multiple surgeries, and after every surgery, the diagnosis became more and more severe. So 3 surgeries later, she was finally diagnosed with invasive breast cancer, and the lumpectomies hadn't removed the cancers completely. So after the second lumpectomy, she decided to undergo bilateral mastectomy. She lived with her bilateral mastectomy for several years before seeing me to reconstruct her breast. And she underwent reconstruction with me in January of 2010, where we removed the tissue from her abdomen to build both breasts. And I'm also very happy to say that I saw Kathy for her 3-year follow-up following reconstruction with me in May of last year. So that's briefly, I mean, we can't even imagine the long journey that everybody went through, but that's a brief clinical summary. So I'd like to start by asking some questions to our panelists. I think my first question that I'm going to open to the floor to all 3 of you guys is, when did the topic of breast reconstruction first come up? Either in your conversation with your physicians or when did the idea first came to your minds? Maybe it was very you, Karen?
I think as mentioned, I have not had reconstruction, and it has always been part of the conversation. It hasn't ever not been. I talk about it with my husband, I talk about it with my oncologist. I go to live, laugh, learn reconstruction events and kind of think about it. So it's always kind of, I guess, kind of on the table, but it's never felt like the right choice for me.
Reconstruction for me was always on the table. It went hand in hand with the choice of doing the prophylactic mastectomy. So the breast surgeries for me were always on the back burner because I lost my mom to ovarian cancer when she was very young. So breast cancer was always wasn't going to happen to me because I was going to die of ovarian cancer like my mother. So not until I had my ovaries and tubes out and I got the pathology back for that, did then the reality of the fear of the breast cancer hit me. And so from then it was sort of a no-brainer, like I need to do this. And it was never really a question of reconstruction or not. If I was going to do the mastectomy, I was going to follow up with reconstruction if I had the opportunity.
I think the same for myself when I was going through the different procedures and the biopsies and the testing and whatnot. It was always thought that we had come to that point, and I dreaded it. The thoughts of having to do that, I couldn't fathom it. But I knew that if and when we did have to do it, that reconstruction would definitely be something that I would want to do. And as it turned out, I guess partly because of coming from Thunder Bay don't have the same resources and surgeons and so on and so forth in Thunder Bay that maybe in larger centers are available. So if I could have had the bilateral mastectomy and the reconstruction done at the same time, I would have much preferred that. That's what I had hoped for, and I tried to make that happen. It was impossible. I knew that I wanted Dr. Zhong to do the reconstruction, and just that wasn't going to be feasible to do that, but I knew all along that I would definitely want reconstruction.
So just to follow up on the theme of access to breast reconstruction, as you know from my biography, I do a lot of health services research regarding the whole issue with access to breast reconstruction because it's not available everywhere. And in the recent years, breast reconstruction has become a mainstream treatment option for women undergoing mastectomy, but that wasn't always that way. I mean, there's still a lot of misconceptions out there that women undergo breast reconstruction for billing purposes. And it's I think it goes so much beyond that, and we need to do what we can to banish that perception. So with that in mind, I would like to ask each panelist how just undergoing the mastectomy itself has it affected your image, your femininity? Karen, we'll start with you.
So I've always been very small-breasted, and so I've never thought it's never been kind of a defining feature of me, my breast. So I don't believe my husband marries me for my breast because he made a bit of wise choice. So I guess I've been married for 17 years now, and for 4 years before that. So I think for me, a lot of my femininity with my mastectomy really kind of tied in with my relationship with my husband. And it took a while, and I'm officially bearing belly here, I guess, but it did take a long time for me when we were intimate for him to touch my bare chest. It was very, very difficult. And for a while, it isn't anymore. And one thing that did change for me is I went to a place that sells bras, and because I'm so small, it's really hard to find mastectomy bras that fit me. And so they found all sorts of bras that they could sew patches in, so I could put was that a camp in. And so I walked out with like sexy little red bras and purple bras, and so that really changed things for me because then I could wear everything again and feel feminine without needing an actual breast.
And I'm the opposite, because I had huge boobs. And I was so insecure about them. I was buying minimizers my whole life and spending $9 on bras, which killed me. And then have these nice little perky boobs that I can buy, wear these tiny little Calvin Klein things. So there's that. I totally get that part of it. And it's nice to hear that maybe in a few years I will let my husband touch me again there, but I'm still not comfortable with that. Sense of femininity, I guess the only thing I can say about that is, in the intimate sense, being with my husband, that part I struggle with my breasts. But I also have my ovaries and my tubes out, so there's that sense of loss there as well. So I'm not sure how much is connected. And a day-to-day basis, no, because I can put on a shirt and nobody knows. Like I walk around sometimes giggling, thinking, people think, nobody knows when they look at me. I mean, not here, obviously, but, being out there, it's almost like a rule. Nobody really knows, and I don't feel, I think it's the whole sense of loss just from the parts that are gone and not being able to have more children if I wanted and that, but in sense of beauty and all of that, I guess it's not, I don't feel that is affected the mastectomy. I think without the reconstruction, maybe I would have had a harder time, but because there are boobs there and I still can put on a little bra and wear a bathing suit, and like I say, nobody really knows the story, so it's almost like you have this brave face. And I like that about it. It makes me more comfortable.
I think because of the way things went for myself, because I had the mastectomy, couldn't do the reconstruction at the same time. And in hindsight now, it's going on 5 years since I was diagnosed. And when I think back to the time now, I would describe myself as being hysterical. I really was. I can remember phoning people and nobody seemed to get it. Like I have to have a mistake. Like it just was so traumatic to me. And then I went for a lengthy period of time without having, and I felt awful. I felt the exact opposite to what you're saying. I felt people were looking at me all the time, that I couldn't wear clothes that I would normally wear in the summer, you know, little sundresses or things like that. I was covering up everything. I've got more vests in my closet than I remember going to Florida, because at the same time too, so not only is it your appearance, the way you look, it's, I might die. Like I'm still waiting for results to come in and things like that, where this may be irrelevant, but it was still very important, but I still may be dying. Like I might only have 6 months to live. So one weekend I went to Florida for 4 days. I didn't care how much it cost, but I can see a sunset on a beach. And there I was in a bathing suit with a sweater on top because I was just so ashamed. So I think, now I'm going to cry. That's okay. I think, so I went that period of time without, but now I can say, and I was so happy. Oh my gosh, when after I had the reconstruction, I had tubes and bags and bandages, and just, it was a horrific scene, I think, for most people to see, but I had breast again, and it didn't matter to me. That, for me, that was, it felt good again. So the mastectomy, I never did look at myself. I never did. The morning before I was going in for the surgery, I did take a picture of myself. That was the first time that I was unclothed when I had a mastectomy.
So if I may also share part of your story, was that Kathy's underwent a major reconstructive surgery where we take the tissue from the abdomen and we have to put it on the chest and hook up blood vessels under the microscope. I believe the whole surgery took maybe 10 or even 12 hours. You were in hospital for 5 days. Because Kathy was from Thunder Bay, I kept you in Toronto for, I think, the first 2 weeks. Finally let her go home. I was sure things were going to be fine. And then I believe it was several weeks later, I either get an email or a phone call from a doctor in Thunder Bay saying Kathy had come into the emergency department because she developed an infection in her abdomen. And I remember I either called you and I said, you need to come in to see me, are you okay? At that point, or at any point, did you feel like you regretted your decision?
No, not at all. The decision to have reconstruction, and I went out to the mastectomy, and I don't know if that's your defense mechanism. I didn't have a choice anyways. I had to have the one removed. The choice of having both done was mine, because the cancer was just on one side. But I've never regretted having both removed or ever regretted the reconstruction. For me, that was absolutely the right choice. Now, whether or not that's something that you make yourself believe, otherwise you drive yourself crazy second guessing things. But I've never regretted the decision, ever.
So let's talk about families and partners. Such a major part of the decision to undergo mastectomy or whether or not to have reconstruction. It's not a choice that you make in a vacuum alone. It's a choice that you make after you consult with family, friends. So can you share with everybody here what your discussions were like with your partners, with your families? How children play into whether or not you chose to have reconstruction? Maybe we'll start with you, Kathy. It's okay.
I remember the night before going for bilateral mastectomy. My daughter and I, we used to always have a bath together on New Year's Eve, so I had my mastectomy January the 10th. And she was 8 at the time that I was diagnosed, so still fairly young, and not, like, you have that book there, and I wish I had something like that to share with her at the time, because she wasn't really at an age that she was old enough to really understand. She didn't have breast yet herself, but I didn't want her to be afraid. So I remember saying to her, I was going to have this surgery, and I'm getting new stuff. I'm just going to be getting new stuff. That's what I do. And she could relate. She could understand that. But I did say, so for a while, there won't be anything, and I didn't want that to scare her, but to try to explain it, and not to scare her by saying, I have to do this because of the cancer, and then, you know, that whole side of it, but that played a big part of it too.
Obviously, having support made the world of difference, and my friends, my husband, my parents, my dad, my stepmother, all they wanted was for me to be here and to be alive. So when I sort of made the decision, there was like a cheer from the crowd. Thank goodness, already, you know? Nobody pushed in any direction. Everyone listened a lot, came to doctor's appointments, but everyone was thrilled when I made it. And I think that can only go along with, you know, making you feel more comfortable with your choices.
And I remember seeing you in consultations and before and after surgery, you were always surrounded by various family members. I remember your mother-in-law was there and passing the phone all around, making sure everyone knew that you were okay after surgeries. That was very nice. And Karen?
Yeah, I guess the one thing that I'm conscious of is making sure my kids see me make it from time to time, so that they're never surprised by the scar on my hood. And I often go talk to my 2 daughters about how, you know, this is not what you will look like when you develop breasts. And, you know, I feel like I have quite an open conversation about that kind of thing. I was just telling Shauna, like, before coming here, I was trying to tell my kids, you know, come in and speak about mastectomy and choice of whether or not to have reconstruction. What do you think of that? And my son said, can I have a snack? Like, I don't know how much now, but they're really concerned about it. I suspect we'll have some conversations coming up as my daughter's develop breasts and puberty and that kind of thing. Yeah, that's kind of the biggest part when I kind of
So Karen, being a young woman and also because breast reconstruction is so in the public now, we mentioned the Jolie and, you know, sort of celebrities coming forward with that. Do you feel pressure from other people to or to undergo reconstruction?
Surprisingly, no. Through Rethink, there's quite a community of young breast cancer survivors that I've kind of tapped into, and I always get excited for my friends when they have reconstruction, and nobody's ever kind of said, "What do you want to do?" Like, it's not. I never feel that way. I'm choosing not to as well. So I feel supported with whatever I choose, and I've often wondered if I'd had a recurrence in the other breast, would that change my decision? It may. I feel really quite at peace. I guess with the kid thing though, one thing I do notice is when I'm putting bathing suit on, or I'm changing a public change room, putting a bathing suit on, and there's kids around, swimming course, I'm quite self-conscious then. And I figured out all sorts of ways to sneakily put on, but yeah.
If I could just say, I think one thing too, when I think that, it wasn't just having had the mastectomy. Now, my doctor, and everybody who's involved in it sees it from a different point of view, right? So my oncologist, of course, you know, do the bilateral mastectomy, don't worry about reconstruction, who cares? Like, as far as he was concerned, that wasn't important. My family doctor, she could see both sides. She's a woman, the oncologist is a man, so they see things differently. But the way she described when the mastectomy was done, that the surgeon did a very good job because it was very clean and it was, but it's concave. So it's not even just that you're flat. And some of the pictures, it was interesting to me, they show that. So I don't know that most people realize that. So it's not only that you could pass off as being somebody who's flat chested, but it's concave, like, but because they do take so much tissue, I guess, to make sure that they get it all.
You can see my heart beating.
So for Andrea and Kathy, for both of you, you have now completed your breast reconstruction journey. Do you feel like you were adequately prepared for what you're living with now, your reconstructed breast? Did it meet your expectations? It's a hard question.
Especially since you said
I know it's, obviously there's going to be some bias because I'm sitting right here, but the reason I ask is because we are trying so hard to prepare women in advance. More and more we're finding out now, at the end of the road, how satisfied you are has everything to do with how prepared you were for your surgery. How much information did you get? Were your own values and preferences, were they congruent with what you received at the end? And so it has less to do with, what type of reconstruction that you had, how long your hospital stay was. Obviously these things matter, but in the end, it's about the preparation process. And so now that you guys have gone through it, I think we want to learn through it.
I think I felt so informed. I felt like any question I asked, you had the time, and not just you, like your team had the time, my nurse navigator had the time. But to be honest with you, nothing could have prepared me. Like, I'm not saying I'm not satisfied now, and I don't live my life feeling good about myself and what I have now, but it was absolutely horrific and traumatic because you can't, I'm not a surgeon, I'm a vice principal in a school. I don't know what it's going to look like to see stitches and skin and no nipples. Like, as much as I looked at pictures online and I talked to people who had had the surgery and I saw their breasts and I touched them after, and I thought, okay, the first few months, the first few weeks, the first few hours are like the worst thing you could ever imagine. Would I go back and change my decision? Never. Well, not 100%. I don't question it for 1 second. But it's hard, and I look at them every day, and I look at my scars, and people say, oh, they're your wounds, you're a hero, and I want to tell them things I wouldn't say. But I get it, and I get what they're saying, and most days that works for me, but sometimes it doesn't still. And I feel angry, and I feel bitter, and I feel, why did this happen to happen? But then I think if my mom was alive 20 years ago and she could have had this genetic testing and they could have said, you have this choice, and she could have had the surgery, then she could have been here. And so you're never going to walk away and say, yay, I'm so happy this happened to me, but do I feel fortunate to have had all the support and all the information that I did? Do I think that your team or anyone could have done a better job of preparing me? No, because I think until it's the physical piece of it. It's not the knowledge of what to expect. It's feeling it and it's seeing it on your body that is hard. But I'm only 5 months out, and so I feel great, and I don't think about it every second of every day, and I can only imagine 5 months from now, it will be less often, and I'll be more comfortable with sort of my scars and, the little things. Like, I remember someone saying, it's hard to sleep with my implants because, it's hard to get comfortable. And so that's now, what I have. But like I said, most days, no. And I like that, you know, doctors, and like you say, you want to prepare people with it, give them as much information as they can. But I just don't think it will ever be, it's virtually impossible to really make people think, oh, this is what she was talking about. This is it. But as I've gone through and I've noticed those little things, I hear voices, oh, that's what she was talking about when she said, okay, so I think they're a bit uneven. But no, oh yeah, they're evening out. She was right. Or, you know, oh, this one really is getting less rich. She knows what she's talking about. So the voices are all there, but it's still in the immediate first little bit, you don't hear all that. So, yeah, I don't think, and I think now, were there more questions I should have asked? Or was there information I was missing? There weren't big gaps, no.
I think my expectations were exceeded. I really do. I think, and again, maybe, they say everything happens for a reason, so maybe it was meant that I had to go through that period of not having the breast after the mastectomy and then having reconstruction, because I was able to see what it was like not to have anything and then to have something. And for me, and everybody's different, I wish I could have been more like that. I wish it didn't bother me as much as it did, but it did. For me, it really did. And I had the prosthetic and the bra and sticking those gel things in. And it was just a constant reminder. And I remember one day, because you don't feel anything, and I still don't, you lose all feeling. So that part of it, you can tell people you're going to lose feeling, but same thing, until you don't feel, you can't imagine. But I remember one day having a dress on it, it was something that was, you know, wasn't tight fitted or whatever, and being horrified because I didn't know if that thing had fallen out or if it was still in place or what. But it was a constant reminder all the time. You were aware of it, and then after I had the surgery, there's days I don't even think about it, and I'm grateful. I am so, so grateful for that it's not that big a part of my life anymore. Now enough time has passed, but it's not that big of a part of my life anymore.
So Andrea, you were diagnosed with a BRCA gene, so that's a gene that predisposes you not only to breast cancer, but like Andrea alluded to, ovarian cancer and other that involve other female reproductive parts. So, Andrea, we try to make things convenient for you. So we coupled your first stage of breast reconstruction with the ovary and tube removal. Do you have any regrets about undergoing everything all at once, or were you prepared for that?
Well, we did a breast reduction at the same, Dr. Zhong did a breast reduction at the same time as my ovaries and tubes were taken out. And I remember when you first suggested it, I thought, that's crazy. Why would I have an extra surgery, still surgery? But then the way you presented it to me was, at the end of the day, your goal is to make us feel as normal and beautiful as possible. And Dr. Zhong explained that there would be a lot less chance, because my boobs were so big before and I had breastfed for a few months, there was some extra skin, that she could have really set herself up by doing the breast reduction first for my second surgery, for the reconstruction, to be much more chance of, I guess, less infection and just more symmetry and all of those things that we ultimately want. So I did think you were crazy, and I think you guys totally, right? It wasn't surprising. But like I said, there's a sense of a connection, like, and I saw several doctors, and I just trusted you and felt safe and comfortable, and realized, like, you're not going to suggest this just for the fun of it. And you know, when I woke up, of course, thinking, what am I crazy? I'm an infant at home, and I couldn't move my arms, and I couldn't really move here. But at the end of the day, there was a closure. Right, I knew that this was just one step in the process, and once the process was over, God willing, I would be done with it. So I guess knowing that there was that end in sight and feeling really informed from our conversations and the research, yeah, I believe it was the right thing to do.
So, I think the final question I'm going to ask everybody is, now that you have been through it, what is the most important key piece of advice that you would, leave women who are similarly in your situation or maybe contemplating undergoing breast reconstruction or just thinking about the process? What's the key piece of advice you would like them to have?
Breast cancer for me has been the single most difficult thing I've ever done. And I think when I had young kids, I tried so hard to be super mom and be there for my kids and do all that. I wish I'd given myself more chance to heal emotionally at the time, because I've had to play catch up a little bit with that. And I don't know how much people realize how big of a part that emotional healing is. And so for me, I wish I'd been gentler with myself. And with that,
I guess just to trust your instincts and do what's best for you. Just because people say this is what you should look like or this is what you should do, it's such a personal choice. I spoke to a lot of people, I asked a lot of questions, and it's scary. And I think just having the support and knowing you're not weak, it's like you said, it was the worst thing you've ever had to go through. And any surgery, regardless of what it's for, is overwhelming. And I would just say access whoever you can, and just be true to yourself and do what you feel is best for you, with no judgment. It's easier said than done, but I'm getting there.
I think the same thing too. I think everybody, it's a very personal choice what to do and when to do it and how to do it. And I think the one piece of advice would be to find as much information as you can. And for myself, I did a lot of reading and research, and one site that I used quite often was this breastcancer.org. So you were able to, you almost felt like you were, I don't know what the word is, like a peeping Tom almost, but because you were reading such personal stories about different people, but you could see lots of different perspectives and get lots of different information that way. And I think for me, knowledge was definitely very helpful.
Well, that theme is in keeping with the Breast Reconstruction Awareness Day, which is there's no right or wrong answer. There's no right timing. It is only one that you are going to live with. The only one that it has to feel right to you. And knowledge is power. And so I'd like to thank all three of my panelists for sharing extremely intimate details and reliving, probably memories that you didn't want to relive, but just for the sake of sharing with everybody. So I thank you for being so honest.
Some time for Q&A, so take some questions from the audience. And
can I ask a question of the doctor? If someone has one breast removed and they want to have reconstruction, do you make them match?
Yes, absolutely. So the first stage is to create the breast mount for what mastectomy has already been. So that's generally what we do in the first stage. We let time for things to heal, for all your tissues to what I call reach equilibrium. Then at the second stage is usually when we do the fine-tuning or the balancing. And at that time, we can also do the final touches to the reconstructed breast, whether it's building a nipple, areola, and things like that.
Do you find that both breasts are symmetrical afterwards? Or do you work maybe reducing one or?
So absolutely, whatever, everybody comes in all shapes, sizes, and forms. So whether it's doing a lift or a reduction or even augmentation, we try to match the two sides as much as we can. I always tell everybody though that we can never replace what has been removed. but we do our darn best in trying to keep something as close as possible.
Can you speak to what those options are? Like, there's one where you take the muscle from the stomach, and then I think another is an implant, and then there's also something that Suzanne Summers was talking about, was they sort of take the fat and they whip it. And
So the two mainstream ways of reconstructing a breast are still using either an implant or prosthesis, or using your own tissue. And then I suppose a third option is a combination of the two. So using your own tissue, the most common place that we take that tissue from is from your lower tummy. So generally that's where we carry most of our weight, and there's more redundant stuff down there. So we can transfer it up to the breast with or without the muscle. So we used to have to pull it up through the muscle. The muscle kind of acts as a vehicle for pulling it up. We now have a more sophisticated ways of doing that because we know that if we can, we don't want to violate your abdominal muscle because that's what allows you to do sit-ups and functional things like that. So now we can just take the skin and the fat from your abdomen, remove it altogether, put it on your chest, hook up the blood vessels so that it survives through new blood vessels without violating your abdominal muscle. That's one major way. The other way is using something like an implant. So something similar to what women who have augmentation have. Other than the difference is this time the prosthesis or the implant has to be underneath your chest muscle. And normally there isn't a space for that underneath your chest muscle, so we have to artificially create that space. And sometimes it takes time to create that. So what Suzanne Summers is referring to with whipping up this fat is that's more of a procedure that we use for fine tuning. So if there's a little bit of area of flatness or irregularity, we can liposuction fat from places that you have extra fat and inject it in so that things contouring is smoother. But we don't generally use that to create a whole breast.
And can you use implant whether or not radiation has been an issue? Is it for conflicting?
Generally speaking, implants and radiation don't go hand in hand together very well. Because radiation does damage the tissues and makes things less elastic. And there are higher complications with using implants when your tissues have been radiated. So usually we have to use your own tissue along with implants.
We have a question over here.
I was just curious, looking at the SCAR project and there's so many different types of scars, and it's not like one type of surgery. And I'm curious if we're looking, most of the women are from the States, so we're dealing with healthcare issues. And sometimes I wonder, are we looking at just different types of doctors? Are we looking at class? What are we looking at here? Or is it just different types of surgery?
So I think
And different bodies.
Different bodies, yeah.
So I think the images that I see here is actually a really nice cross-sectional representation of the women that I see in my clinic. So everybody has a different body habitus, and because of different treatments that you may have had or not had, certain options may be available to you and not available to someone else. So when I look around this room, I see different types of reconstruction where it may be necessitated because they don't have enough tissue in areas or because they may have had radiation or chemotherapy. But I think what I see is a really accurate representation.
Thank you.
How long does it take to do the complete, like from the time that you start to finish?
Unfortunately, probably too long. There used to be this belief that when you are diagnosed with breast cancer, you have to live with your mastectomy defect for 2 or even 3 years to make sure that cancer doesn't come back before we reconstruct. We now know that not to be true. However, depending on the reconstruction method that you have, so for example, if you have an implant, oftentimes we have to put a spacer or a temporary prosthesis there to artificially create that space. That's one surgery. You have to keep coming back to me for that prosthesis to be pumped up. That may take 2 or 3 months. You have to wait 3 months after that for all your tissues to heal. Then you have to have another surgery. When we take out this temporary prosthesis, put in a permanent prosthesis, then you wait 3 months for that balancing on the other side, and then having to go areolas takes a year to undergo. Other times when we're using the tissue from your abdomen, even though we do everything all at once, it's a long procedure. It takes maybe even 12 hours when we're doing both sides. You're in hospital for 5 days. We say recovery is 2 to 3 months. And then you have to come back for another surgery where we do the nipple and the finishing touches. So too long for my case.
Maybe I could follow up that question by asking two of you who had that procedure. Speaking from the perspective of someone whose partner just had your procedure, and what that 6, 8, 10, 12 month period is like psychologically, you know, as you see the change, you see the healing, you know, the next stage, what that's like.
I think one thing Dr. Zhong said to me when she was preparing me for the surgery was that it could take 10 to 12 hours, which seemed mind-blowing to me. It does. And based on everything I read and different people's experiences, that was true. But she said, you are going to feel like you were hit by a truck. You wake up, and that was a very, very good description, because I remember vividly when I woke up, it was, you just felt like you were hit by a truck. But every single day, it felt better. Like every day there was improvement. Mind you, in my case, because I ended up with the incision, got the infection where the tissue was taken from, and because I was having to come from Thunder Bay, I don't know if it might have been different had I been here, but because I was having to come back and forth, so it did seem like a long time at the time. But now in hindsight, that seems like such a small piece of the puzzle. Like that's behind me now. I'm thrilled. I am absolutely thrilled and wouldn't hesitate to make that same decision again. So the answer to your question, it continues to get better every day. Yeah.
Mine was different though because I didn't have the tissue expanders, and I put my faith and I didn't know which was I going to get chosen for, the Alloderm, which was the one step. That's what I thought I wanted, and then I realized, you know, there's pros and cons to both. So I actually had my mastectomy by my surgeon, and then Dr. Zhong came in and put the one step. They were already made and ordered for my size, right? I think you designed them, and they popped them in, and I didn't have any other surgeries. So that psychologically, just knowing, before I knew which implants I was going to get, I was horrified, thinking, well, what if I get the other one and then I have to have another surgery? Because it is psychological. You wake up, you know, okay, at least the surgeries are done. So every day it's not getting better. I'm not going to have to go back under and do it again. But it does. It screws with your head a lot. But it does get better. Yes?
Other than tattooing, how else do you create the nipple, an areola?
So the nipple itself, usually there's enough tissue around the breast itself that we make small incisions and we gather it. I tell my patients kind of like organic. We fold it and we make a 2D surface into kind of a nugget. And around the outside where the areola is, generally we tattoo it. But some patients don't like the idea of having even medical tattoo, in which case we can take skin grafts from elsewhere on your body. We usually take those skin grafts from places that are concealed so nobody would know that there is a hidden incision somewhere.
Thank you.
Any other questions from the audience? Comments?
I have a question. If a woman has a mastectomy or bilateral mastectomies and then chooses to have a child, how does it affect that prosthetic implant for the reconstruction?
So if someone has had a mastectomy with reconstruction of any type, if it's an implant procedure, I mean, obviously they can't breastfeed from it because there's no breast tissue
I
left.
understand that.
But in terms of healing and other things, everything would go on as you normally would.
Just normal, okay.
If you had the tissue taken from your abdomen, and because, you know, when you're pregnant, you have to allow things to stretch. Generally, people do okay, but I do follow my patients very closely, especially young women who have a pregnancy after I take tissue from their abdomen, just to make sure that they don't have complications from the surgical scar.
Thank you. Thank you to our panelists again for sharing your stories with all of us. And Dr. Zhong, thank you so much. You're obviously compassionate and passionate about what you do, and I knew you were the right choice for this panel. So please feel free to hang out for a bit. You can look at the images. Unfortunately, we're out of the programs, which actually tell a story about every single photograph. We are having more printed, and the gallery will be open this week if you'd like to come back and take a look. If you want, I can also send you a digital copy of all the bios for all the photographs. I can give you my card, and you can contact me by email as well.
So that not just the added to the website where these pictures are, or no?
No, the SCAR project website is separate from us. It has its own website. The bios are done in a program book that follows the SCAR project around.
And just to let everyone know, the SCAR project is actually 100 photos. And so David J, the photographer, kind of keeps a rotation of about 30 photos. So each time you see the exhibit, it's always changing and growing and evolving.
And just one other thing, as a breast resident, is that we do have another talk on Thursday night.
Thank you.
We have a different style of talk, more in the cultural critique kind of way, in and around beauty and body image and the beauty myth and how different images affect women's identities and sense of self, and where the SCAR project fits into that conversation. So it's similar time, 5:30 to 7, so anyone who'd like to come back, that'd be great as well. Thank
Or
you.
spread word.
Or spread word, yes, thank you.